Guys, we are in week 8. We are halfway through. You guys have just come off of doing your own videos. You were teaching me a thing or two about chronic heart failure. And the reason we did that assignment was to basically hand the baton to you, and you can now demonstrate to me how well you are starting to understand pathophysiology with exercise, and how well you can speak about these issues, how well you can present on them, because it's not just all about knowing the information, it's about being able to convey that information. And that is one of your primary roles as a strength and conditioning expert, or as a exercise physiologist, or as a physiologist. Not only being able to understand the physiology, but to convey it to others who don't understand it. So today we are going to be diving into metabolic diseases, and these two that we're going to be focusing on are going to be renal and liver failure. Now, in my textbook, my ACSM textbook, this is chapter 20. And I'm going to just double check right now because I have it in front of me. And this chapter 20 is on page 126. So this is under section 4, metabolic diseases. So I hope those of you that might have the new textbook, it might be a different chapter. So please look into that and make sure you guys have the right information. And for some reason, if the new version doesn't have this content in it, which I can't see why it would not, please reach out to me ASAP and I will get a copy of it to you. So yeah, let's get into this end stage metabolic disease. We're talking about renal and liver failure. And we're going to talk about basically the kidneys, and we're going to talk about the liver, talk a little bit about what they do, a little bit about the pathophysiology, and then get into what this means for exercise. So now that we're at the midpoint, you might have noticed that this course has been heavy on conditions and exercise, understanding how exercise can change these conditions, also understanding how we need to prescribe exercise for somebody living with some of these different conditions. So what we're going to do now over the next few weeks is, after we take our second exam, which is coming down the pipe, I put it up on the calendar, so please make sure you check the calendar. As we get deeper into this now, the next half of this semester, it's going to be focusing primarily on prescription. And you guys are going to be kind of taking the reins and telling me how you would design certain exercise regimens for people living with these kind of conditions. So that's coming down the pipe, and that's what we're going to be focusing on in the later part. So the first part of this course, I've really been trying to kind of introduce you to the concept of disease, how the disease changes the physiology, or how the physiology changes under a chronic condition such as the disease. And then the other kind of point we've been trying to make is that with exercise, we can kind of reverse some of these diseases. And we've talked about that in great detail, about how if we have somebody with heart disease or AFib or chronic heart failure, if we do aerobic exercise, they can increase their scores on their VO2. So now these next few weeks, we're going to be talking about how to assess, because your textbook doesn't really tell you how to assess. It just says you can do a treadmill test or you can do a submax test. So I'm going to be introducing those tests to you now. For those of you that are in 456A right now, you're getting the best of both worlds, because you're already being introduced to some of these assessment tests, right? We're talking about the Astrin submaximal test. We've talked about the walk test a little bit. We've talked about the VO2 graded treadmill test. So you're kind of getting a little bit of an appreciation for how these tests are. But for those of you that didn't have me or haven't taken 456A, you might be like, I don't know any of these. So we're going to start introducing some of these, because it's very important. It's very relevant that you start to understand all of these pieces being put together to make a giant picture, right? So let's talk a little bit about the first condition. There's going to be two systems here that we're going to be talking about. The first one's going to be renal, which is kidney, and the second one is going to be liver. So let's talk about the kidneys a little bit. So what do your kidneys do? So here's your kidneys. You'll see that one of them is slightly higher than the other one. That's because the liver sits under here. So we're going to have a little bit of an elevation in this kidney here. Your kidneys, your uterus, your bladder, they're all a part of the urinary tract. You can kind of see that here, right? Obviously, you have two kidneys. Some people are born with one kidney. Some people donate a kidney. And what the kidneys do is they filter your blood. They remove waste. They add extra water to make your urine. They reabsorb water back into the bloodstream. So they have quite a few different tasks, right? They help for glucose reabsorption back into the blood. They're a highly complex system. You'll notice that they're highly vascularized, right? We can see artery, we can see vein, we can see that there's lots of vasculature in these organs here. Essentially, every minute, approximately 1,300 milliliters of blood enter the kidneys, right? So that's quite a bit of blood. And let's say close to 1,299 milliliters leave the kidney. So that means that approximately 1 milliliter leaves the body as urine, right? So if we were to have, let me put this up here just to kind of give you a visual, right? So every minute, 1,300. It's my right hand, bear with me. It's getting better. Look at those circles. They're starting to look good. Okay, 13 milliliters enter the kidneys, right? So the blood's going to come through, okay? And then 1,299 milliliters of blood leave the kidneys. So that means 1 milliliter per minute is basically going to leave the body as urine. All right, so highly efficient machinery. And the kidney, not only does it basically do what I just mentioned to you, but there's many, let me erase that. There's many other, sorry about that, many other, geez Louise, what is going on here? Got it, yes. There's many other roles that the kidney plays. So it can maintain the balance of electrolytes, and I'll repeat this several times. It can maintain the balance of electrolytes, the acidity of the body. It plays an important role in maintaining pH, the overall fluid in the blood. Well, let's just stop there and let's think about exercise for a moment, okay? When we exercise, your vascular system, your arteries, arterioles, they dilate, right? So we have more blood moving through the system. So blood volume is very, very important when it comes to hemodynamics and maintaining homeostasis. It's also very important when we have more blood volume, because then there's more for the heart to eject out of the heart, right? We'll have some fluctuations in blood pressure. So the more blood volume we have, the more efficient the heart becomes at kind of maintaining blood volume. As you begin to exercise, you have a lot of hydrogen ions that are released from contracting skeletal muscles, right? So that could play a role in kind of making the blood a bit more acidic. So the kidneys play a role in kind of managing that, right? If we're sweating for long periods of time, what happens to electrolytes? Well, we lose electrolytes through sweat. So just in those three examples right there, the kidneys kind of help maintain and stabilize the electrolytes, the pH, and the fluid. And we know that exercise is going to destabilize all of those. Well, so does a diseased condition, right? So when we have whether it's end-stage renal disorders, or we have diabetes, which is also associated with these diseases, or we have hypertension, they kind of alter the electrolytes and the acidity of the blood and the blood fluid. So there's a dysregulation of that when it comes to certain diseases, right? Basically, the kidneys kind of balance all of these things, and they maintain all of these values no matter how much you eat or you drink or you exercise. So if your body is dehydrated, the kidneys will basically put less volume in the urine, right? So that ratio that I told you before, that 1,300 versus, 1,300 volume or 1,300 milliliters of blood go into the kidney, 1,299 come out. Well, during exercise, we might have slight alterations to that. And then when we exercise in a disease condition, we're going to have alterations to that even more so. So you got to understand how all these things work and the important role that the kidneys play in that role, in that function. So, and if the blood becomes too acidic, the kidney removes more of that acid from the blood, and that acid is excreted in the urine. Same is true for electrolytes and other waste products. So this is a really, really important filtration system that helps kind of maintain homeostasis. And that's not even including exercise. So what happens when we start to run into some acute or chronic conditions with the kidney? Well, those basic functions are going to be impaired. And then when you add exercise to that, that's going to kind of make things even more convoluted and more complex. So I kind of summarize all that here. So the kidneys maintain balance. Essentially, you can look at these, and I'm going to just kind of talk while you're looking at them. I kind of already mentioned all this. In a real easy way, a real easy way to kind of memorize the different roles that the kidneys have in human health is to basically think of the word a wet bed. All right, so a wet bed. And A would be controlling acid-base balances, right? So it's going to control the pH in your blood. pH can change in a disease state. Exercise can change pH. And what the kidney is going to do is kind of help regulate that and stabilize that acid-base balance in real time. Okay, so A stands for acid-base balance. W, right? A wet bed. W would mean controlling for water balance. So again, if you're drinking a lot of water, you're inactive, and water might change blood pH levels, right? It might make it more basic. Well, then you'll pee more, right? If your blood is becoming more acidic and you're drinking water, you might pee less until the blood is more base rather than alkaline, right? So if we want to kind of raise the pH, we'll keep more water, right? E. So we're saying a wet bed, right? So E would be electrolyte balance. So we want to keep equilibrium of all the electrolytes. Too much is a bad thing. Too little is a bad thing. Okay, so the T in wet is removing toxins. Okay, and one of the things that the kidneys play a really important role in, some of the waste products that removes, is creatinine, urea, and ammonia. And urea and ammonia are very toxic to the body and very toxic to the cells when they're not removed. So urea and ammonia, when we eat way too many proteins or amino acids, so those of you that are on your caveman diets or doing the all meat diets, you are doing a tremendous amount of damage to your kidneys, because your kidneys have to remove all the byproducts of consuming that much protein, which is both urea and ammonia. So be very careful with what you buy into with the YouTubers when they tell you you have to have 900 grams of protein when you bench press in order to get your pecs to look massive. Most of those idiots on YouTube have not done medical school. They don't understand physiology. And they don't understand what is being done to their body and the long-term effects that it might be having because they're eating so much of this protein. So we talked about a wet. So here, let me just kind of let me see if I can just kind of throw this in here for you guys so you can see it, and I can kind of share it with you. Let me see if I can shut this down here. Let's add this. There we go. Give me 1 second. Give me a second. Let me just move this over. Let me move that like that. There we go. See, I have notes here that I always take, and I can share this note with you, right? So a wet, right? A wet. And then let's talk about bed. So there's the first part of it. So we know BED So the first letter B is controlling blood pressure. How is it going to control blood pressure? Well, it does so by controlling blood volume, right? So if we have low blood volume, the heart has to work faster to pump less volume. If we have lots of blood volume, the heart doesn't have to work as hard because there's more volume for the heart to contract with. And so that's how we basically would have blood volume impacting physiology with the heart. So let's put B there, controlling blood volume. E, this is an important one. E would be producing hormones such as erythropoietin, and erythropoietin, there it is right there. That's a precursor to red blood cell formation. So the kidneys play a role in increasing red blood cell creation and red blood cell circulation. So it plays a vital role in that. So the kidney has a hormonal effect. And then we have the last letter D, activating vitamin D. So it does all of this and more. Let me fix this because they're not all the same font, and my OCD is going to kick in and bother me, and there we go. So there's kind of like a long list of everything that the kidney does. So, and when it says including nitrogenous waste, this is again referring to what I had mentioned earlier about urea and ammonia. So those things that come from nitrogen, which, if you remember from biochemistry or organic chemistry, every amino acid has a nitrogen base. Those nitrogen bases are generally not metabolizable, so the body has to convert the nitrogen into ammonia, urea and ammonia in order to get rid of it in your urine. So if you're taking lots of protein and lots of expensive protein powder, essentially all you're doing is oversaturating your amino acid pool in your body, and you're peeing out very expensive nitrogen-heavy urine. So yeah, keep that in mind. So let's talk a little bit about your acid-base balance. So acids and bases in the human body are always in a state of delicate equilibrium, right? So we don't want too much acid because that drops the blood acidity. So you guys should be taking notes on this as I'm speaking, right? So if we have too much acid, and I'll just so I slow down my speaking a little bit, I'll just kind of draw. If we have too much acid, then the pH level of the blood drops. And if we have a drop in the pH level, well, that means that all of these proteins in our blood that generally, right, proteins are quaternary structures, which means that they're like these three-dimensional balls of these functional amino acids, right? So if the pH balance drops below generally 7.4, because that's where blood likes to be, and it drops, well, then what happens to these proteins is they start to denature and they become linear, right? So then we have a protein that is no longer doing its function because it's no longer in this form in which it functions. It becomes linear, and then we just have all these amino acids. I'm just going to kind of draw them like this, kind of strung together with bonds, and now the protein doesn't do what it was designed to do, right? So in this state, when the protein is folded upon itself and it's held together by hydrogen bonds and held together by covalent bonds, it's functional. But when the pH drops, those bonds are released, and then we basically have just this linear strand of amino acids that no longer has a purpose or a function. So when we keep this delicate equilibrium, we know that as pH, right? And the normal pH of blood is anywhere between 7.35 to 7.45. So I'll just say 7.35, right hand, give me a break, to 7, that one's a little better, 0.45, right? That's where we like to keep our pH. And to maintain this healthy range, the kidneys basically excrete either acids or bases when there's an excess of them, okay? And they maintain these compounds when the body is lacking them, okay? So the kidney will help stabilize that. When we're talking about controlling water balance, this one's a little easier. Basically, the kidneys, they function to maintain water balance in two main ways. And they do so by regulating the volume of urine they produce. And they do so by basically adapting to one's hydration level. So when you drink a lot of water, the kidneys will produce more urine. And the opposite happens when you are dehydrated. It will retain water. So that water balance is just this kind of delicate dance between too much water and not enough water. And the kidneys will respond to that by essentially getting rid of excess water if you have too much of it, or maintaining what little water you have if you're dehydrated. So those of you that are drinking water all day long and you're peeing all day long, well, that's just your body's way of saying, hey, the kidneys are functioning well. They're doing their job. They're getting rid of too much hydration in the blood, because if we have too much hydration in the blood, too much water, that changes the acid-base relationship the other direction. The blood will become more basic, and the same thing will happen here. These proteins will kind of denature, right? So we'll leave that 7.45 and we'll go above it, right? Because we know that when we become more basic, we can go up to 11, right? So 7.5 to 11, we've moved that direction, then we're becoming more basic, and that's not where those proteins in our blood like to be. All right, so the two ways that it does that is basically by saying, hey, we're going to keep urine, or we're going to create more urine, okay? Maintaining electrolyte balance. This is very similar to what we see in acid-base relationships. So the kidneys will filter some electrolytes from the blood, and they'll return some of them back into circulation if the body needs it, or if the body doesn't need it, it'll excrete it. So let's talk about this. Let's say you guys are taking vitamin B12, and I'm just picking this one because it's very obvious. So you're taking your vitamin B12s, and you're also taking a lot of vitamin B in through your diet. You're a conscious eater. You're eating the right amount of food, right volumes, and then you go pee, and your pee is bright yellow. Well, the reason it's bright yellow is because your body is excreting the vitamin B12 that it no longer needs, right? Now, that's not an electrolyte per se, but I'm just giving you a visual, right? Because we can't see calcium, we can't see potassium, we can't see sodium, we can't see glucose in the urine. So I'm just picking something that has a color to show you that, hey, it's going to remove those things, okay? If we talk about removing toxins, well, the kidney will filter out water-soluble waste products, and it will flush them out of the body with the urine. So those things, again, can be anything that has this kind of nitrogen base to it. Creatinine, urea, ammonia, those things are all harmful to the cells. Your body's going to get rid of those waste products in a very quick manner. So the kidneys will help kind of regulate that. And yeah, so let's move on to the next slide and talk about a couple more other functions that are super important. One of the things that the kidneys do is they control blood pressure, and they do so by producing renin. This renin is basically an enzyme that will help maintain blood pressure. It produces erythropoietin, which again stimulates red blood cells, activates vitamin D for bone health. So let's talk about this renin for a little bit, because this is a really important system, especially for exercise science. So the kidney produces this enzyme called renin, and renin converts another protein, which is called angiotensin, produced in the liver, into an active form, which is angiotensin 1. Now, I will have visuals for this down the road. You don't need to know what these things are. Just kind of follow along. And so basically this angiotensin 1 is this activated protein. It goes to the lung, and in the lungs, it gets converted into angiotensin 2. So it kind of goes through these series of conformational changes, and it all starts at the liver. And when angiotensin 2 is circulating through the blood, it basically constricts the blood vessels and increases blood pressure. So even though this enzyme, renin, is initiated in the liver, in the kidney, it communicates with other organs. And I'll show you a picture of that momentarily. Let me see if I can grab one for you now, and I'll walk you through this just to be a bit more fair in my description. So hold tight for 1 second. Okay, so as promised, here's a picture of that. So we can see that renin, which is this enzyme that is found in the kidneys, is released, and renin is going to be converted into something called angiotensin 1. And as I said before, angiotensin 1 will go into the lungs. So you can see, right? Well, it's converted by another enzyme from the lungs. And this is called angiotensin converting enzyme, so ACE. And this enzyme will essentially convert angiotensin 1 into angiotensin 2. So you can see that there. And then angiotensin 2 plays this role in water retention, blood pressure, and most importantly, vasoconstriction. So people that have kidney disorders, people that have kidney diseases, sometimes they have a lot of this circulating. And because of that, they have chronic vasoconstriction. And because of chronic vasoconstriction, they have chronic increases in blood pressure. So what I want you to guys start thinking about is, okay, well, if we have somebody that has a high level of blood pressure and they're basically hypertensive, that's an H, sorry, hypertensive, okay. How do we approach exercise with somebody that already has this kind of high blood pressure? Like the exercise seems to be it's a kind of a dangerous concept when we're thinking about that. So just wanted to kind of show you that picture there. So other things that happen with the kidney. So I told you that it activates vitamin D. So here's that right here. So normally vitamin D is dormant in the body. It has to be activated by the kidneys. And the kidneys basically transform this inactive form of vitamin D to an active form of vitamin D. And then it has this really massive impact on metabolic functions. And this would be kind of the focus of what we're going to talk about today. So it can impair gluconeogenesis, whether it can accelerate it or decelerate it. It kind of depends on where you are in kidney failure. It plays a role in metabolizing drugs and substances such as insulin. So we'll talk a little bit about these today, but I just want to kind of show you like the overall function that the kidneys have. So it's a very, very important organ. And just in case you don't know what that system looks like, I do want to go through it just a little bit. So the kidney, obviously, just a little bit of anatomy here. We're not going to do a deep dive into it. It's this bean-shaped structure, and it's about the size of a closed fist. And most people have two. Some people have one. They lie against the back of the abdomen wall, and they rest just above the waistline. So in the lumbar or the lower back region. So right, because if this were your spine here, right? So they're right in this kind of lumbar region here. Another important thing is, let me see if I can find a better picture, is we have these adrenal glands that sit on top of the kidney, right? It looks kind of like a hat, like a dunce cap, like the kidney's wearing a dunce cap. And we know that the adrenal glands are part of the endocrine system. So they're glands, they secrete really important hormones, one of them being renin, which I just talked about, that regulates blood pressure, also regulates sodium balance and water retention, very important things. So we know that not only is this an organ that is going to help infiltrating toxins and maintaining clean, healthy blood and maintaining maintaining urine volumes, but it's also has an endocrine organ that just kind of rests right on top of it. So let's just kind of draw these little glands here, right? Boop, boop, like little hats. So the adrenal glands are there. The right kidney sits slightly lower than the left one because of the position of the liver. I mentioned that earlier. And these things have lots of blood vessels, and it makes sense, right? Because it's basically filtering your blood and creating urine. So let's just kind of go through a little more of this, just just in case you're curious, you wonder how this all works and where the blood is filtered and how it gets to the urine. So let's just kind of go over a couple of things here with anatomy. So we have, let's start with, where do we start? Let's start with the cortex. Let me draw. So, oops, no, I want that. Yes. Green's good. So we have the cortex right here. And what does the cortex do? Well, it's the outer region of the kidney, and it contains about 1.5 million of these renal tubules. And these tubules, they kind of look like this. This is how we transport the blood and the water, kind of all like this, like these tubules, right? What else do we have? What else do we want to talk about? Let's talk about the medulla. So we have the medulla, and this is the middle region, which basically acts as this kind of collecting chamber. We have the capsule. Here's the capsule here, and that's just the outer membrane that surrounds the kidney. It's really thin and really tough and really fibrous. So we're just kind of doing a little bit of an anatomy lesson here, so you can kind of understand more of what's happening here. We have the renal pelvis. And this is like a basin-like area, and it collects urine from the nephrons, and the nephron is basically what does the actual filtration. So the renal pelvis will basically collect what is filtrated, and then that will send that material down to the uterus. And it's part of the filtration system. And what else do I want to talk about here? We already talked about the arteries. Let's talk about the arteries. Here we go. Where are they at? There they are here. We have the renal arteries, which is basically a pair of arteries that branch off of the aorta, bringing waste-filled blood into the kidney for filtering. Every minute, the kidneys receive about 20-25% of the blood that is pumped by the heart, and it basically just delivers that blood so that the blood can be filtrated and those toxins can be removed. We also have the renal veins, which are right here. These remove the filtered blood from the kidneys, and basically now you have clean blood that can go back up to the heart. And then we have these other things here, which is the glomerulus, and I'm going to show you that on the next slide. But basically, if we look inside of this nephron right here, right, this is where the magic of filtration happens. So the nephrons are going to basically filter everything, and it's going to send urine down this tube here, right, into the uterus. So the next slide is going to kind of focus on these guys here. And this is where much of the damage happens in kidney disorders. So that's kind of one of the reasons I'm kind of showing you this, is just to kind of get your head wrapped around this a little better. And I probably will not test you whatsoever on anatomy, but I do want you to understand what this nephron does, or the glomerulus, the Bowman's capsule, the efferent and afferent arteriole, because this is one of the few organs in the body that has two arterioles that feed into it. So it's very unique in that way. We have the proximal tubule, we have the distal tubule, we have the collecting duct, and basically this nephron here is what basically collects urine. And then once we start kind of moving down these tubules here, we have all this exchange of acids and bases, and all this exchange of electrolytes and sugars, and this is where the magic happens, where we either get rid of water or we reabsorb water. It all kind of happens within these collection tubules here, and then it goes down to the collection duct, which then goes down into your urine. So it starts here at the nephron. We have the blood being delivered here by the renal artery, and then each of these nephrons, we have an efferent and afferent tubule or arteriole, and then this is where the magic happens. This is where the filtration happens here. So let's take a look at before we get into that next part, I just wanted to kind of throw this in here as well. I told you that the adrenal glands are responsible for basically secreting this renin, right? Well, it's also really important in secreting some other very important hormones when we talk about exercise. We can see here that we have cortisol that is released, just like in exercise. We have cortisol released. Estrogen and testosterone, that's really important for post-workout. These are the kings of, or queens of exercise, right? Epinephrine and norepinephrine. We have these catecholamines. And then we have things like aldosterone, which also helps in basically vasoconstriction or vasodilation, right? As if you can see here, aldosterone kind of plays a role in this angiotensin pyramid here. So when we have kidney dysfunction, right, we have end-stage kidney failure, well, that's going to impact how you respond to exercise, right? We know that this is super important for increasing heart rate, for causing vasodilation, for many, many things associated, sweating, releasing glycogen. These play a role in all of that. This plays a role in recovery. This plays a role, cortisol plays a role in exercise. So all these things kind of play a role. And if the kidney is damaged, and we have this adrenal gland on top, which is experiencing complications due to renal injury, well, then we're going to have a major impact on exercise and the regulation of steady state, maintaining and achieving steady state during exercise. So I just kind of wanted to show you that it's not just this running piece here, but it's all these other really important components that we see with exercise. So now let's move on to this one. This one's a bit more complicated. Don't worry about all this mess here. I'm just showing you the basics. Okay, so we left off here, right? This is what I told you. We're going to kind of zoom in on this nephron here. And that's where we are here. It's the same thing. You see that glomerulus? So this is basically where we have filtration, and it's called glomerulus filtration. And this is filtrate is basically made out of blood that is coming through, and it is filtered through the collection of this collection of capillaries in the nephron called the glomeruli. And that's what we have here. And you can't zoom in and see all that, but we know that this efferent blood is brought into the efferent arteriole. It's filtered in this network here of capillaries, and then it leaves again through this afferent arteriole. And basically, we're going to have some filtration here, some filtrate that is removed from the blood, and it's going to enter these tubules, okay? And this part is called, this is where we're going to have either reabsorption or we're going to have secretion in these tubules here, right? And this is where the balance is made. I told you electrolyte balance. I told you acid balance. I told you water retention, hydration, dehydration. All these things are going to be impacted here in these tubules. So the next thing I want you to pay attention to is this filtered blood is then going to go through a process of, we can either have disposal or reabsorption. And you can see by these arrows right here and here, right here, if we're basically pulling things in to go into urine or releasing things to go back into the circulation. So you can see water, we have reabsorption of water back into the body. That happens here in this kind of, let me go back here just to identify that. This distal tubule, right? And this is a tubule, just think of a tube, right? Like a curly straw. This is what makes up your kidney and your uterus and your bladder. And we have, well, let's see, we have water being released here, reabsorbed back into the body. We have solutes, sodium, potassium, calcium, those things being reabsorbed back into the body. Or if we're not reabsorbing it back into the body's going to pull it, and you can see here it's being pulled into the tubule to be released into your urine. So that's how these things work. And you can also have, let's see what else I want to talk about here. Well, I guess that's it. I just wanted to kind of show you that this tube here in the kidney is where we basically get rid of things or reabsorb things. And just to kind of refresh your memory, that's where we have all of this magic happen. We have acid-base balance, we have control of water balance, we have electrolyte balance, we can get rid of toxins, and that's all happening here through these tubules. So the glomerulus pulls in the blood, it removes some of that filtrate, and then based upon the condition of the body, the tubules here, the renal tubules, we will basically reabsorb things and put it back into the body if it's needed, or will completely secrete it and get rid of it through the urine. And then you can see here that it's delivery to the urine. So that is how this happens. And I wanted to just kind of show you here. Here's another picture just kind of showing you what happens here. And you can see that there's this kind of various exchange of goods. So we can see hydrogen ions, sodium, hydrogens, chlorine, right? It's just calcium, amino acids, right? We can see that glucose can be pulled out of the tubules, because this side here is representing the tubules. This is the interstitial space. This is the bloodstream. And you can see that these things are, sodium and chlorine are pulled back into the bloodstream. Calcium is pulled back into the bloodstream here. We can see that glucose, we can pull the glucose out of the filtrate, and glucose can be put back into the bloodstream. And even water, magnesium, right? Magnesium can be pulled out of the tubules and put back into the bloodstream. And water can be pulled out of the tubules and put back into the bloodstream. So that would be the reabsorption process. And then on this slide, it's just another picture kind of showing you kind of a zooming in on that, this piece here, right? I showed you this earlier, right? This glomerulus and this capsule space and the efferent and afferent arterial. They're arterials, so we know it's bringing blood to the kidney. So if we look here, we can kind of see that zoomed in. So we can see that the afferent blood, the afferent arterial, brings the blood in, and then we have this network of capillaries, right? Glomerular capillaries. And then after we extract some of that filtrate from these capillary beds, this enters the tubule here, right? The renal tubule. Then we have the efferent arterial, which goes away. But look at, this is the cool part here, is the reabsorption of some of these things that they've been talking about, whether it's glucose or whether it's solutes or acids or bases or whatever, that reabsorption happens back into the efferent arterial. And that's why I wanted to show you this picture, because it's really a remarkable system, right? So once we have the filtrate that is removed here, we run into the efferent arterial, and then we could have tubular reabsorption back into the efferent arterial. So if we look at this, in that section, in that efferent arterial, we can be pulling in sodium again. We can be pulling glucose back into there. We can be pulling magnesium and water back into there. So it's a very remarkable and very complex system. And then we can also have, in this same manner, tubular secretion. And then here's that kind of definition of that tubular secretion. So within this very closed-knit circuit, we have a lot of trading and exchanging of goods to figure out what the body doesn't need and what it does need. So it's truly, truly remarkable. So now let's get into this kind of chronic kidney disease or chronic kidney disorder. And how these things are generally categorized is by something called glomerulus filtration rate. And that is basically, if we go back here to this glomeruli, it's how well this thing is doing its job and how well it is filtrating or not filtrating. So we're not going to get into that, but I want to show you that there's kind of 4 stages of kidney damage, right? And what we're talking about is this kidney failure stage, right? So we got these 4, we got kind of acute stages right here, right? Acute, or this would be normal. This would be mild and acute. This would be moderate and acute. And then we start to get into these like really harmful stages of kidney disorder. And these things are generally associated with many, many comorbidities or many other conditions such as diabetes and hypertension and heart disease and metabolic syndrome. And then the reason we're kind of selecting these guys here is because this is where we start to get problems with metabolic issues. And we start to get problems with other metabolic issues such as renin-angiotensin 1, angiotensin 2, and vasoconstriction, which is going to impact blood pressure. So if the kidney regulates blood pressure, and it does so by removing water, retaining water, but this system is altered because of a disease, well, then the kidney really has its work cut out for itself. And that's why this one is very complicated when it comes to exercise. So let's kind of just talk a little bit about the overview of the pathology. And we're not going to go deep into this because this is a long lecture. So I'm just kind of going to talk to you guys a little bit about just the overall process of end-stage renal disease and kidney failure. So this last stage of chronic kidney disease, it can be caused by underlying health problems, often diabetes, often high blood pressure. That is one of the major components of end-stage kidney disease. And this happens when the kidneys can no longer filter the blood of waste or extra fluids. It just kind of loses its ability to do so. And what happens is, as you get further along in this kidney disease continuum, right? Because that's what this is, right? It's a continuum. We start at healthy, and then it kind of goes to this severe kidney disorder. So as we get further along in this continuum, we're eventually going to need dialysis or kidney transplant to survive. So can people with dialysis exercise? Yes, they can, but it has to be done very cautiously. Can people who are in this acute kidney disorder exercise? Sure, they can. People with severe kidney disorders, yes, they can, but you have to understand the complexity of this system and how exercise is going to either save the kidney or impact it with more stress. And we got to be very cautious of that. So, and then in this final stage of this chronic kidney disorder, once we kind of progress to that, your kidneys just can't do their day-to-day job and they fail. And then when you're on dialysis, depending on the degree of dialysis that or the degree of the damage, I should say, of the kidney, you could be on dialysis for 2 hours a day, 3 days a week, 1 hour a day, 5 days a week. And that's a part of your life. Your kidneys can no longer do their job. And now you have to rely on a company and machines to filter the blood and do all these other things that we talked about, all these other things for you. So we have to rely on technology, and that's going to be a part of your life for the rest of your life. So some of the signs and symptoms that are associated with kidney disease, fatigue, edema. So we have swelling, we have constant swelling in different parts of the body, anorexia, nausea. Skin disorder, colors and changes in the color of the skin, neuromuscular changes, seizures, heart failure. So these are things that it makes sense, right? Because the kidney is involved with so many other systems. We don't really need to know this. I'm just kind of throwing some general ones out there that you need to concern yourself with. But now if we talk about the consequences of renal failure, this is a big one, metabolic acidosis. That means that your body cannot get rid of the ammonia or the urea. It cannot regulate the blood pH. Therefore, your blood gets very, very acidic. And you can run into major systemic complications when you have acidosis. That's something that diabetics commonly have, is acidosis. Hypertension. Well, as I said here before, let's go back up here. If we're having issues with renin, and renin is constantly being secreted because of injury, well, then we're going to have conversion of all these enzymes, and then we're going to have constant vasoconstriction. And then if we have constant vasoconstriction, we have an elevation in blood pressure. So that makes sense that hypertension would be a part of that. Left ventricle hypertrophy. Well, left ventricle hypertrophy is great if you obtain that from running. But when you obtain hypertrophy from a disease, that means that the left ventricle and the cardiomyocytes in the left ventricle, the cells in the heart, they're going to go through hypertrophy. They're going to get bigger, and then that's going to result in changes in ejection fraction, and that's going to cause changes in how much oxygen is going to leave the heart and saturate the blood. You could have neuropathy, right? So if you're having issues with delivering blood and delivering oxygen and delivering metabolite or certain macronutrients to other parts of the body, we can get peripheral neuropathy. So we can have neurons which will start to perish. And one of the major components of neuropathy, and why is neuropathy important for exercise? Well, because if you have neurons that are perishing, you lose motor units. And if you don't have motor units, what's going to happen to muscle contraction, right? You're going to basically start to have muscle fatigue, and you're going to have atrophy, right? Because you're losing the neurons that are going to fire those signals to the skeletal muscle. So let's look at this really quick. One of the things that happens with diabetes and other metabolic diseases is, you can see glucose right here, right? Glucose is reabsorbed into the bloodstream in the kidney. So if you have a high level of glucose in the blood because you're diabetic, and then your kidney can't help get rid of glucose and it's reabsorbing glucose back into the bloodstream, well, that means that your glucose levels are going to be skyrocketing, right? Which is going to mean that your kidneys, which should be getting rid of glucose, is going to be putting more glucose back into the blood. Now, if you have glucose circulating in the blood at very high levels, this is a glucose molecule. I'm just going to draw this 6-carbon glucose molecule. If you have glucose circulating in the blood, well, one of the things it will do to cells like neurons is it will destroy them. That's a neuron. Just bear with me. I'm drawing with my right hand. That looks pretty damn good for a neuron. And then we got the dendrites, right? So it will destroy neurons because neurons can't regulate how much glucose comes in. So we'll have neuropathy. We'll start destroying really important neurons, muscle fatigued, elevated triglycerides, right? So we'll have higher levels of fat in the blood, elevated cholesterol. So these things are really important reactions, responses to damage of kidney or kidney damage. So what about exercise now? Well, we're just going to kind of mention a little bit of exercise right now, but we're going to get into it a bit more later after we talk about the liver. So let me see if I have that here. Okay, so is exercise okay for people who are suffering from kidney disease? Well, patients with chronic kidney disease are generally inactive, and they have reduced physical functioning and performance. But aerobic exercise interventions have been shown to increase maximum oxygen consumption in these patients. So exercise can be beneficial because, as I said, we use the VO2 max machine to determine, or VO2 max to determine levels of health and levels of fitness. And the higher our VO2 score, the more resistant we are to chronic disease. The lower our VO2 score, the more susceptible we are to chronic disease. Okay, so if we can increase someone's VO2 who is impacted with living with chronic kidney disorders or end-stage kidney failure, well, we can increase their fitness level and their health level. Some studies are now showing that aerobic training can also improve other factors associated with health. People who are doing aerobic training, they seem to have a longer survival rate. They avoid hospitalization more frequently. Resistant training also, even though it's less studied, it seems because resistance training really doesn't have much of an impact on VO2. So a lot of these researchers are going to look at VO2 scores. It can increase muscle strength and size and may improve muscle function. And that makes sense too, right? Because as we exercise, and as we lift weights, we know that one of the major adaptations that occurs with exercising is neurogenesis. We get more neurons. So if we have peripheral neural degradation, right, if our fingers and our hands and our arms and our legs are all being impacted and we're getting neuropathy, well, if we start exercise training with weights and we do strength training, well, that might help neutralize some of that neuropathy, and we'll get something called neuro-NG for genesis, and we're just building more neurons, right? Also, there's some evidence out there that is mixed, suggesting that aerobic exercise training can improve blood pressure control and lipid profiles in individuals with chronic kidney disease. It may also reduce other comorbidities such as heart disease and diabetes. We know that if you can control diabetes, you can get control of these kind of other systems that are impacted by diabetes. So sure, if we exercise frequently, we control the diet, we might be able to reverse some of this kidney damage. And that kind of just depends on where we are on this continuum, right? If we're here and we're on dialysis, there's really no coming back from it, right? Because unless we get a new kidney, and that's why we have to get kidney transplants. But, if we're somewhere in here with a moderate or mild exercise, and this is if this is based on diabetes or hypertension, I'm just going to put a D for diabetes, well, exercise might be able to reverse that. Because we're lowering blood glucose, we're lowering circulating triglycerides, right, which is fat. We're increasing healthy HDLs. So we can kind of restore some balance to the kidney with that process. So let's move on now to the liver. And I promise you the liver is going to be a bit less painful because it's way more complex and we just don't have the time and space to talk about the liver in as much detail. So let's go to end-stage liver failure, and we'll see how long this takes us. Okay, so on to Mr. Liver. A very complex organ. We're not going to spend a lot of time here because I assume you just kind of understand how important these organs are in regulating both normal physiology and exercise physiology. So let's talk. Let's see, where do I want to start? Let's talk a little bit about the liver. So the liver is both an organ and a gland in the human body. So that means that it is going to secrete, it's going to process macronutrients. It's going to help kind of store glycogen. It's going to help store lipids. It's going to release glycogen. It's going to release lipids into the circulation. It's this kind of spongy, wedged shaped, reddish brown in color organ that's about the size of a football. The liver is an essential organ for literally performing hundreds of functions necessary for sustaining life. And again, it's a gland because it also makes proteins and hormones. So just like the kidney, which is a gland, it makes proteins and hormones from the adrenal gland. The liver does the same thing. And that's why this is kind of important to talk about in the realm of exercise. So let's just talk about a couple things that it does, because we just don't. There are people that spend their entire careers researching the liver and what it actually does. So very similar to the kidneys. It clears toxins and harmful substances out of the blood. So this also kind of removes some of those things and helps metabolize them. It gets rid of old red blood cells. So your blood cells usually have about a 3-month lifespan. And after that, they need to be taken off the shelf. They've reached their expiration date and we need to get rid of them. So the liver helps get rid of that. It also makes bile. You guys know what a bile is. It's fluid that helps your body kind of digest and break down fluid. And if you're on campus and you've had one too many Coors Lights and you spend most of the night with your head in the toilet and you're vomiting, eventually you will get rid of all of the substances in your stomach and you will dry heave. And that's when that wonderful green, oozy, slimy material called bile comes out. So your liver is helping create that bile. Metabolizes proteins, carbohydrates, and fats so that your body can use them. You know that. Regulates the amount of blood in the body. So just like the kidney, it plays a role in regulating. See, that's why we paired these things together, because they do a lot of the same things. And most importantly, for the realm of exercise, stores glycogen. You guys know that. A very important source of glycogen that we use normally, the liver does a lot of the glycogen breakdown, not only during exercise, but also while you are sleeping. So to keep your brain alive while you are resting, the liver will break down glycogen into glucose. It'll enter into the circulation, and that will pass the blood-brain barrier. And while if you're sleeping 10 hours, 8 hours, 12 hours, it will basically keep you alive. So here's more on that. You can read that on your own, because I've been doing a lot of talking here, and you guys understand all this stuff. You guys can do that. We'll just do a little kind of anatomy lesson here. So there's two major parts of the liver. We have this large right lobe, and then you can see that here, and then we have this smaller left lobe. And basically blood travels through the liver. The liver will clean it. It will remove the toxins and waste that eventually will leave the body through the urine and the feces. So this one plays a bigger role in waste management for your feces. And basically, the liver contains thousands of these really small lobes, and these lobes connect with bile ducts. And these bile ducts, which you can see right here, common bile duct, this is what's going to basically be secreted into your small intestine to help kind of break down foods and neutralize fats and get everything ready to be transported into the small intestine. So, if the liver starts to experience any type of trauma or injury, then we're dealing with multiple systems that are going to be impacted by this, right? So, we know that toxins and waste won't be removed. Bile might be jeopardized, the function of bile. If bile is jeopardized, then we're not going to have proper breakdown and absorptions of nutrients in the small intestines. We might have glycogen issues. We might have glycogen secretion issues, whether postprandial. So that would mean after that you ate, you might not have glycogen forming properties anymore because of liver damage, or while you're sleeping, you might not have glycogen release because of liver damage. So it can have a lot of different impacts on the system. So what conditions now cause liver disorder? And I have this picture here, and I'm just going to kind of go over a couple of these. Don't get lost in all of this wordiness. I just couldn't find an image that I thought kind of told the right story. So basically, there's many conditions that can affect the liver, and the ones I'm going to talk about right now are the most common. So diseases that occur when a person consumes too many toxins, such as alcohol. So we can have alcohol-related liver disease or fatty liver disease, right, which is just kind of an extra fat that the liver kind of collects and creates because of the alcohol. So we can kind of put that into cirrhosis here, because ultimately alcoholic fatty liver disease will turn into cirrhosis, which is this scarring of the tissue. You can have inherited diseases where you have iron overloading in the liver, or Wilson's disease, which is too much copper in the body. So too much copper and too much iron can cause liver disorders. We can have liver cancer where we have abnormal growth, or too quickly, or hepatocytes are growing too quickly. We can have problems with the immune system where the immune system attacks the liver, such as hepatitis. So hepatitis, you can see here. We could have, what's another one? We could have hepatitis A, hepatitis B, hepatitis C. Those are all viruses, essentially, that are going to cause massive, so here's the virus infection, massive inflammation, and that inflammation is going to cause problems in the liver. And then most of these conditions can lead to cirrhosis, or this scarring of the liver. And when we have scarring and we have tissue that becomes scarred, we're going to have dysfunction of the liver. So sometimes, again, liver damage occurs just like kidney damage. And I'm going to just kind of go back to refresh your memory. It happens on this continuum, right? We can have acute damage, we can have a moderate acute damage, we can have severe damage, and then we can have just complete liver destruction. And some of these injuries can be reversed, and the liver is one of the few tissues that can regenerate itself or grow back. But more often than not, when we have liver disease, this can cause life-threatening issues. If it goes past the point of no return, we cannot regenerate liver, hepatocytes or parts of the liver, and it's going to lead to serious symptoms and life-threatening alterations in physiology. So just kind of know that, liver, we can get cirrhosis from drinking, we can get hepatitis, we can get infections, we can get drugs that can cause these injuries. And then also keep in mind that we can have things like diabetes, which is going to impact both the liver and impact kidney, right? So we can have this kind of metabolic That's a K. I forgot what I was drawing there. We can have these metabolic disorders that can kind of damage the kidney as well. So let's go to what are the signs, and I put this in the wrong place, and I apologize for that. But what are the signs and symptoms of liver problems? Well, one of the major problems or symptoms of liver disorders is jaundice. And jaundice, basically, your skin becomes white or your eyes turn yellow because you basically have too much bilirubin in the blood. And bilirubin is kind of like this yellow waste product that the liver gets rid of when it breaks down red blood cells. So remember what I told you is your liver is trying to break down red blood cells that need to be taken off the shelf because they've exceeded their shelf life. And one of the byproducts of red blood cell degradation is this yellow waste product called bilirubin. And high levels of bilirubin indicate that there is a possible liver problem. And that's one of the things they do with children when they're born. Children, essentially, they check for bilirubin to see if their liver is functioning the right way, just to make sure that the early stages of life, they have normal liver function. Other things could be buildup of fluids in the belly, where we have this kind of retention of fluids in the stomach. We can have easy bruising, we can have itchy skin, we can have edema, and we can have changes in blood pressure that are chronic and frequent. All right. So again, lots of things that the liver does and takes care of. Let's see. I want to go back up to. Let's go up to this one now. The overview. Where am I at? Sorry. Here we go. Here we go. So let's kind of go through like the overview of the pathology and talk a little bit about this. So usually one of the first signs, and this is, you guys see here, this bubbly liver, right? This would be, well, let me go back to draw this over here. This would be your cirrhosis, right? You have this uncontrolled scarring. And when we have the scarring, we also have changes in form and function of the liver. So we get these like cute little warts and scars and fibrous tissue all over it. Usually one of the first signs of liver complications is elevated enzymes. So usually when you guys go get a blood test, we can measure enzyme function in the liver. And when we have high levels of enzyme activity, this usually indicates that we have some type of issue. So several diseases kind of start out that way. And then we can, like I said, we can get these other things like jaundice and hepatitis, which is this inflammation. These are, again, the most common forms of this injury. So hepatitis, alcohol, metabolic disorders such as diabetes. You don't have to worry about this one. Infection, that would be the virus. Okay, so this last slide kind of summarizes everything. So we talked about the types of injuries that the liver can experience, and we went over those in enough detail. You guys get it. We have normal liver function, and when we begin to attack the liver with any one of these inducers, the liver is going to undergo some basic changes. So we're going to have inflammation. We're going to have deposits of fibers, or this kind of fibrous tissue that's going to be deposited in the matrix between the cells. So we're just going to have some changes, some alterations in the cell. We'll have some cell death. And we'll have angiogenesis, which is new veins or new vessels being created. So you can see that this liver here is way more vascularized than this liver, right? So the liver is just trying to figure out what is happening and how to protect itself from these attacks. So one of the first stages in liver damage is fibrosis. And fibrosis is basically the accumulation of this really tough fibrous tissue. It's this scarring. And this is the first stage of liver scarring, is this fibrosis here. And then if the damage or the inducer is chronic and it continues, we can move from fibrosis to cirrhosis. And unfortunately, cirrhosis is always associated with alcoholism, and cirrhosis is just any of these kind of liver failure stages or this this scarring, this uncontrolled scarring of the liver. And also, with cirrhosis comes liver failure and hypertension of certain parts of the liver. So it's this total reconstruction of the liver. So the most serious point of liver injury is this cirrhosis. And basically, when we get so much scarring on the tissue, the liver and the individual cells are no longer allowed to perform their functions. And this happens, again, this is not just alcohol related. We have it from viral infections. We have it from hepatitis. We can have metabolic disease such as diabetes and those things kind of creating this type of liver. And then it gets to the point where we will need a liver transplant. So I am going to stop there simply because this lecture is over an hour, and I want to give you a little bit of time to digest this. Now, what I'm going to do on the following lecture is I am going to finish the exercise component. So now that we talked about the liver, what it does, how it responds, the kidney, what it does, how it responds to a disease, we're going to talk about the exercise component, and we're going to add a little bit of an assessment piece. So I don't want to throw too much at you, so let me stop here. We will just call this lecture A, and then at the end of the week, I will provide you with lecture B. So let's just kind of get going on this, and then I will add more near the end of the week once you've taken a look at this.